We have here with us Dr. Timothy Quinn to break it all down. All right, good afternoon, Dr. Quinn. Some questions we have to ask you now. How can you tell the difference between the flu and strep?
You know, that's very difficult. As a medical provider, I'll tell you, we get a lot of patients to come in on a daily basis, and they'll have typical upper respiratory tract symptoms. But it is important, as you mentioned, to try to diagnose specifically what their medical condition is, because the treatment course is different. And once you have that diagnosis, you can better provide the appropriate treatment. But typically, those with strep throat will have a lot of their symptoms isolated to the throat. They'll have a very sore, irritable, itchy throat. On examination, it's very red. But typically, if someone has the flu, they have a more generalized presentation where they typically have cough, congestion, body aches, headaches at times, and a lot of fatigue. So these are just some telltale signs of what it is you're treating, so you can isolate that diagnosis so you can give the proper treatment.
Okay, so you mentioned a little bit about the differences. Thank you for that. Now, but what can patients do to help protect themselves?
Well, there are a lot of things that we can do during this time of year. It's Christmas time. It's the seasonal time to get together. And in a lot of cases, that increases the risk, because if someone at these gatherings has the flu or have COVID, which is very prevalent right now, unfortunately, or that they could have strep throat, coming together in these large groups close together indoors increase our risk. So what we can do is, number one, make sure that we've had our vaccinations. Now, the vaccinations are typically going to take 2 weeks, but let's still get them if we haven't done them yet. And that includes getting your flu shot. And if you have not already done so, up to date on your coronavirus vaccinations, including those new boosters that are very, very effective. And just, if you feel a little bit under the weather, having those upper respiratory tract symptoms, go ahead and get evaluated by your medical provider. And if you are identified as having infection, don't go to the gatherings. And also know your risk. If you're high risk, meaning that you're someone that's elderly or have chronic medical conditions, then it's a good idea, if you do go, to try to social distance and go ahead and wear that mask. The CDC is actually recommending that people consider masks again, because we want to try to keep our infections down, enjoy the holidays, but understand that we can have an impact from preventing ourselves from getting sick.
All right, thank you so much, Dr. Quinn. Very helpful tips right there.